Good morning, everyone. Today we will be discussing about whether the worst of the coronavirus is yet to come. So there are three main factors why I believe that the worst of the coronavirus is yet to come. Number one, people do not understand the meaning of exponential growth. So what we mean by exponential growth is that, for example, if you have a small size pond, a body of water, and you have lily pads that are growing over them. So how many days do you think it will take the lily pads to cover the entire pond? So the answer, for example, for a small pond would be 30 days. But how many days do you think it takes the lily pads to reach half of the pond? That is true, that is 29 days. So on 29th day, the lily pads have just covered half of the pond. But on the 30th day, they would be covering the entire pond. So when this virus spreads, it has a very exponential growth. Each person is infecting 3,000 more, and each of those 3,000 more are affecting 3,000 more people. So we have to be very careful when it comes to the exponential growth. And unfortunately, in the coming days, I hope it does not come true, but unfortunately in the coming days there would be exponential growth. So we have to be prepared for the worst. Second is that whenever you open any website, for example, if you open the USA statistics for today, number of deaths would be divided by the number of infected people to calculate the ratio of those dying. So that roughly approximately comes out to be 2%. But that's not the true figure. The true figure that you have to look when you are calculating the true percentage of people dying from this disease is the number of deaths divided by number of deaths plus the recovered patients. Because those who are still infected, they may or may not live to see the day. So when you do this maths, then the percentage, unfortunately, it comes out to be 14%. And that is deadlier than any virus in the last 100 years. So this is another very alarming factor that we have to keep in mind. Third is the quality and the capacity of the healthcare system that is dealing with the virus. And that is why it's so important that you are staying home. So what happens with the healthcare system is that in the initial days, if you look at the data from China, Wuhan had a death rate of 21%. Why? Because their entire healthcare system and the quality of healthcare system and the healthcare providers, they were overrun by that massive spread. So other provinces, they only had 1 to 2% death rate. Now when you compare that, you can compare that with another pandemic as well. So another pandemic would be SARS. So for SARS, the death rate is close to 10 to 12%. But do you know that there were many patients of SARS in USA, but their death rate was, yes, you are right, their death rate was only 0%. Why? Because in USA, they kept having the best possible healthcare facilities available to them. But in Africa, the death rate was much higher because the quality of healthcare system over there was not good enough. So although we should remain optimistic, we should keep complying with the government restrictions, and we should keep hoping for the best. But coronavirus worst is yet to come, and we need to be ready when it comes. So this time we do not take it lightly, and we can avoid as many avoidable deaths as possible. Thank you.